In Massachusetts, indicators for the opioid crisis show little sign of improvement overall, but they also point to a growing racial disparity. Over the past 3 years, figures show a spike in the death rate for the Black population. There's also an increase for the Latinx population emerging 6 years ago. To tell us about the numbers and some possible causes is a senior research associate at the Boston Indicators Project in the Boston Foundation, Peter Ciurczak. Thank you very much for being with us, Peter.
Thank you for having me.
Peter, yes, please.
No, go ahead.
I want to ask you about this main pattern that you're seeing here, because most of the time we get all these stories about mass and caste, and there's this miscellaneous group of people. And at the same time, there's a distinct change in the racial composition you're seeing statewide. How big a deal is this?
This is actually a really big deal, Chris. Much of the story of the opioid epidemic in Massachusetts has been the story of the opioid overdose-related deaths among the white population. But in 2020, we actually saw a decrease in the white opioid overdose-related death rate down to actually below both Black and Latinx death rates, opioid-related death rates. And these spiked over the pandemic and are now the highest in the state. And in the case of the Latinx death rate, opioid-related overdose death rate, as of 2019, is the highest after Connecticut in the country. So these are very significant increases and may very well change the story of opioid overdoses in the state going forward.
Because one of the things we want to make a distinction about here, this is not necessarily about the odds of using opioids or even overdosing and surviving. This is about people who overdose and do not survive. So what's the difference? What's the issue there?
Well, I think we would prefer to have people who are, through dint of circumstance or through their own kind of life, now using to try to cope with various things they might be going through. We'd like to see them through. We'd like to allow them to, if it becomes necessary, make sure they survive this particularly trying time in their lives. But as people continue to use, and as we'll probably talk about at some point in the near future, fentanyl, it's making it difficult to see these people through their crises and see them through to their next stage of life where they're able to kind of move past opioids or move to better jobs or whatever through the crisis that they're faced with.
Well, for people who are not as familiar with it, explain the threat of fentanyl, because we know it's cheap, it's really strong, and it can be mixed with other things in indeterminate quantities. So what does that mean for the user?
Sure. Fentanyl is an additive for opioids and increasingly the stimulant cocaine. Basically, it makes any drug you're using at any particular time more powerful. It's about 50 times more powerful than heroin. And for users, this can very much come as a surprise. We have basically a sense that 92% of the opioid-related deaths in Massachusetts in 2019 actually had some amount of fentanyl in their body as they died. A lot of times this takes people by surprise. For cocaine users, we've actually seen an increase in the amount of fentanyl found in those overdose-related deaths as well. About 85% of cocaine users, overdose deaths included some amount of fentanyl as well. So this is an incredibly potent kick that often can catch users by surprise, and particularly stimulant users who do not have or who may not have a kind of slight resistance or slight temperance of opioids. As a surprise and for these users, it can be devastating. And
the uptick in fatalities with opioids for the Latinx population, that really went up noticeably about 5 or 6 years ago. What do you think drove that?
It's hard to put any particular, silver, we see that this happened and therefore it increased. But in 2020, the United States government released a report that kind of gave us some suggestions of why Latinx overdose deaths might have increased. They suggest that, particularly trying journeys across the American border or into Massachusetts or into any other state may kind of leave these travelers with some degree of trauma. We've seen that Latinx users are, to a certain extent, afraid of interactions with the state. And that by that I mean EMTs or police departments or things like that. So they will not call, or they will not have friends or relatives call state support services when they might overdose. Oftentimes, Latinx communities or Black communities as well do not have access to the kinds of treatment or the kinds of support services that a lot of kind of white opioid users might have access to. So just a massive number of all of these things here, that thing there, may very well contribute to these kinds of increases we've seen not only in Massachusetts, but nationally among Latinx users.
I know a few years ago, we had these stories about deaths of despair, mainly affecting the white population in this country. And if you put that in the map, it was something at some remove from places like Massachusetts. But for this problem with the opioid crisis, it seems the worst of it is in New England. Why should that be the case?
Hard to say. One particular thing that we've seen and that we've seen from the Department of or the Drug Enforcement Agency is that there are cartels that operate in New England that are very well established and are able to move a lot of fentanyl and heroin and other opioids into the region in ways that they might have a little difficulty or might run up into some resistance in other parts of the country. As for kind of our Black and Latinx population that are now seeing increases, it makes sense a little bit that as kind of treatment and services and awareness has really reached the white population, that these services have been more slow to come to the Latinx and Black populations, though those efforts are ongoing. And there are people that are working very hard to kind of get those services to the people they need.
Well, I know if nothing else, what's going on at Mass and Cass has gotten us accustomed to thinking of services as something that are at least logically, if not ideally, concentrated in one area for a lot of users. But if you're talking about reaching the populations that you say are most affected right now, the Latinx population, the Black population, doesn't that mean maybe thinking differently, thinking outside of that kind of cluster box?
There are certainly a variety of service centers that are both, located in Boston, as you've mentioned, but also in some of the larger Spanish-speaking towns, a lot of, Lawrence and Lowell and those areas. But for concentration of use, it's a little difficult to really kind of spread out when so many other services, like hospital services in particular, are so concentrated in these areas. We've seen that a lot of Spanish-speaking services have begun to spread out across greater Boston, so that has been good and allows kind of users access to those services outside the core. But it's hard to say. I guess we'll see what the next mayor of Boston has to say about Mass and Cass and what they'll be doing.
One other thing I want to look at behind the figures, especially for the Black population, because last year there was the trauma that sort of peaked with the death of George Floyd, but at the same time, a lot of people traumatized by that do not use drugs, but there are other factors at play in the mix there. And I'm thinking, what about the economic dislocation caused by the pandemic? Could that be one of the things happening here too?
We did a report back in 2018 about the kind of origins of the opioid epidemic. And we, at that point, didn't find direct correlation with economic circumstances, but it is hard to look back on the past year with unemployment rates for the Black and Latinx populations of 12 and 15% across the pandemic, with distinct lack of access and food scarcity, and being unable, a lot of folks and a lot of families being unable to afford kind of basic necessities. And think that this has not had some kind of impact on families who may have had a challenge in the best of times, but were really struggling under the pandemic and the shutdown of the state. Oftentimes these were folks who were released first from their jobs or alternatively required to work in extremely trying circumstances. Certainly the pandemic has been hard on a lot of us, but for many people who are struggling already, it was really, really devastating.